1 o'clock, so I want to say good afternoon, everyone, and thank you for joining us. My name is Chuck Davidson. I am the President and CEO of the Manitoba Chambers of Commerce, and on behalf of MCC and our co-hosts, the Winnipeg Chamber of Commerce, we want to welcome you to the second webinar in a series called Asked and Answered, Q&A with the experts, and today we're talking about maintaining healthy Manitoba workplaces and hygiene protocols amid COVID-19. Special thanks to today's expert guest, the Honourable Cameron Friesen, the Minister of Health, Seniors and Active Living, and our Chief Provincial Public Health Officer, Dr. Brent Roussin. To get us started, it's my pleasure to introduce the Manitoba Chamber of Commerce brand new board chair, elected at MCC's first ever virtual annual general meeting last week, our 89th, Ms. Peggy May, the CEO of Southport Aerospace Centre. Peggy?
Thanks, Chuck. As Chuck said, my name is Peggy May, and it is my distinct pleasure to undertake my first official duties today as the Chair for the Manitoba Chambers of Commerce this year. The Manitoba Chambers of Commerce are located on original lands of Anishinaabe, Cree, Oji-Cree, Dakota, and Dene peoples, and on the homeland of the Métis Nation. These past 3 months have been a challenge like no other for Manitoba businesses, and we have all been learning and adjusting with remarkable resilience. Clear, effective reopening plans matter to all Manitobans, and we know that implementing public health protocols in our workplace is critical to protecting staff and minimizing risk. To that end, we are very fortunate today to have this opportunity to engage with Minister Friesen and Dr. Roussin, who have both been very busy this week consulting with Manitobans about the government's preliminary Phase 2 recovery plan. They're here to answer your pressing questions related to healthy workplaces amid pandemic recovery. We will begin today with some remarks from each of our guests, followed by a question and answer co-moderated by Chuck Davidson and Lauren Remillard of the Winnipeg Chamber. Questions have been solicited in advance, and there are many, but if we didn't have an opportunity to submit those earlier, please feel free to type your question into the chat stream. We'll work hard to get through as many as we can. Your question, please know that we will forward them to government for clarification and collect the answers that you need. Now, before we begin, let's go to a quick poll so we can gauge who's in attendance today. The poll question should pop up on your screen. Simply select your corresponding answer based on the size of the business you operate, and we should soon have a snapshot of the results. So it's tell us about you. I guess I get to play too.
I represent 500 plus employees.
And let's see where we go from here. Answers, wow. Quite a diverse group of people here today. Very interesting results. So the biggest class is in the 11 to 50. Okay, well, thank you for that. And now I invite the Honourable Cameron Friesen, Minister of Health, Seniors and Active Living, to share some opening comments with us. Minister Friesen.
Thank you, Peggy. Good afternoon, everyone. Great to be here. We are privileged to have the opportunity to talk to the Chamber in this way. I'm here with Dr. Brent Roussin, who is a stranger to no one anymore in the province of Manitoba. Brent is incredibly hardworking, but I think one of the real success stories in Manitoba has been Brent's willingness to get out in front and to engage groups. Very approachable. I know the hours are very long, but I think that's been part of the way we've been able to communicate well and effectively and transparently on where we are and where we're going. As you said, Peggy, we just officially yesterday updated the document on our Restoring Safe Services Roadmap for Recovery Phase 2 document, which I've got here with me. And I know that a lot of people have already downloaded this document. They've gone to the website. They've had input. We've had this document public for about a week's time now, and that's given a lot of opportunity for input, and that's what we need. This document is for Manitobans, but it's by Manitobans, and it's our plan to try to restore services as we go forward. I'll keep my opening remarks brief because I know we don't have tons of time together. I'll say just a few things. First of all, I would say thank you to the business community. Business and industry and their response has been, I think, a fundamental to our good results on COVID-19 thus far. We know that the disruptions that this has had in workplaces, in our economy, have been very significant. And I know it come with undoubtedly tons of challenges on a daily basis for people to solve. Sending workforce home, managing inventories, working with various parts of your operations. But you've done it, and you've done it well. And now as we've reopened, even in phase one, I congratulate businesses for the creativity, for their foresight, and for their attentiveness to create a plan that would work to keep their customers and their employees safe. There are just so many success stories to see how you go into a business, or you go and see a manufacturing plant, or you go and see some other enterprise, a retail, and you see the ways in which this is being done. Partitioning, keeping the 2-meter distance, clearly mapped pathways for people in an establishment. The barriers we're seeing put up between at a checkout place. That's all very good. And we know that along the way we've had good input, and we continue to give good advice to groups as they go along. I mean, look at our numbers are very good compared to Manitoba, or compared to other places in Canada. We know that. 2 new cases today, but clearly, we've had a bunch of days where we had no new cases. More importantly, I'd say in hospital right now, no one with COVID-19, no one in an ICU, no one who is on a ventilator. We worked very hard in the last 2.5 months to ready our healthcare system for COVID-19, and we now have capacity. We also worked very hard to increase testing, and then to be able to get that testing result back to people in a timely way. I was really pleased to see yesterday we had over 1,000 tests. Test numbers are again very high today, and that's good. We need to continue to do that. The reason I mentioned that to a business community is these are the fundamentals that we must do as system planners to be able to help you get back on with things. Because as we open the economy back up, we are going to have new cases of COVID-19. But Brent Roussin said yesterday in a call, we have to learn to live with COVID-19. We can't simply close down our economy for a year. So now's the time to reopen. Do not be fearful when you see some COVID-19 numbers each day. Our success is not going to be zeros of new cases each day. Our success will be in the way we manage those cases. Good testing, prompt reply of the result, and then our ability to notify people, monitor them at home, keep them at home so they can recover and use the hospital appropriately as needed. So I won't say much more for right now. I would say we've gotten a number of fundamentals right. Now we're at the point where we can be doing new things. And some of these new things involve asymptomatic testing. I'll let the doctors speak more about that at some point, but also strategic asymptomatic testing. Because we know right now that the risk for Manitoba is not so much community spread, although that will be more as we open the economy, but it's right now the importation of the virus from other places. So that could be truck drivers returning from long haul runs. It could be workforce coming into Manitoba from other jurisdictions. That's the kind of area where we need to be vigilant. So that's why we are testing asymptomatically. And I think I'll just, I won't go through the phase 2 document, but I'll say to you that we are on track right now to make the implementation of phase 2 as Monday. That has broad implications for many of you of how you run your business. It also helps Manitobans get back to other things that they want to do, recreation and sports and arts and cultural activities. So we're looking forward to that. But again, I would finish by saying our approach is one that we think is a balanced approach, using the evidence of where we are to guide us safely and appropriately while we continue to work on the other side to keep Manitobans safe. So thanks again for being here. I appreciate the opportunity to make opening comments. Looking forward to our discussion today.
Okay, my first unmute button, my apologies. Thank you very much, Minister Friesen. Really appreciate your comments. Looking forward to the discussion today. It is time though for another poll question. We'd like to ask attendees about your business's experience throughout the pandemic. And here's the question up on your screen. Tell us about your experience. Give us a few moments. Oh, I guess I should.
Be an interesting question.
All right. Are we ready to release the results? Is it me or nothing's up? Oh, there we are. Okay, so 56% of you operationally, we never closed, followed by planning a reopening for phase 2. So taken together, that's almost 80% that either opening or have already opened. So well done. Thank you very much. Also, just before I introduce Dr. Roussin, just again, congratulations, Peggy May, on your move into the chair role at the Manitoba Chambers of Commerce. Assured you will do a fantastic job and represent the organization extraordinarily well. I do now have the pleasure of inviting Dr. Brent Roussin, Chief Provincial Public Health Officer, to provide his opening thoughts as well. Dr. Roussin, thank you.
Thanks. Afternoon, everyone. Happy to be here. So always want to thank Manitobans, especially the business community, for their efforts in flattening our curve. It's certainly been Manitobans that have stepped up and has put us in this position to be one of the last provinces needing to have a substantial close down, and one of the first to be able to reopen and restart our economy. And we're getting a lot of attention nationwide for just how broadly we're able to open our economy at this point. So hats off to all Manitobans, especially our business community. And certainly business is going to have a distinct role to play going forward. We need to ensure that Manitobans can be out and that we can reopen our economy. There's much more to health than just this virus. And so we're going to continue the success, and then we're going to be able to move into phase 3 as we continue that success. And we're going to be relying a lot on the business community to do that. So we know a lot of businesses had to step physical distancing, cohorting of employees. You may have heard of an outbreak that occurred where that company was already cohorting employees, dramatically decreased the likelihood of a significant outbreak there. So so there's a lot of roles to play as we move forward. So we've seen our numbers, and what kind of things are we looking at? So certainly looking at the cases, but we look at our positive test rates are quite low. If we look in the last week, it's 0.08%. Positive, the proportion of our tests that are positive. If we look at other jurisdictions in Canada, it's about 5 to 6%. So magnitudes higher. And so Manitoba is in that good spot. We monitor different things like activity in our emergency departments, bed utilization, ICU utilization, all looking quite good at this point. And like the minister mentioned, we've built up our capacity in our healthcare system. And so we have that capacity available should we see more cases. But we have that ability to test. We can test, detect cases early, self-isolate them, self-isolate their contacts through contact tracing. So we're putting ourselves in that spot to once again contain this virus should we see it again. We know that based on our epidemiology, Manitoba looks quite favorable to a lot of our neighbors. And so our biggest risk is importation of virus. The 2 cases today, travel related. And so, so that's good because we're picking them up and we're not seeing community transmission. We're picking up travelers, but it does remind us that we do have that risk of importing this virus. So we need to maintain our diligence with those type of activities. And so, moving forward, this new normal that we have, I'm confident that we're taking a very prudent steps here, and I'm fairly confident that we're going to be able to continue our progress moving forward because Manitobans have really stepped up. They demonstrated that they take this virus seriously. They demonstrated that they know what to do to prevent the widespread transmission of this virus. And so one of the biggest things in this new normal is that we just can't have people who are showing symptoms of illness out in public. We can't have them shopping. We can't have them showing up to work. It's just that new normal, and it is new. That's not how it's been. I fought through colds before at work. Everyone has. That just can't happen anymore. And so moving forward, we have to have this this new norm that's just not going to be tolerated anymore if we want to continue moving forward. And so when dealing with advice to businesses, to individuals, it's very difficult to provide advice on every specific eventuality. So what we do is we just need to understand the basics of this. One is that this virus is transmitted almost exclusively by people who show symptoms of respiratory illness, and it's spread almost exclusively by droplet spread, meaning that it doesn't get suspended in the air. Only people within 6 feet, 2 meters of these people are really at risk of it. And so right there is where our foundations come from. Sick people not out and about, and maintaining physical distance. We know that the virus can live on surfaces for some time, and this is why frequent hand washing, frequent disinfection of frequently touched surfaces. And so it's whenever the questions come up, whenever we're not sure, it's getting back to those basics and applying them to that situation. And that's what you'll hear probably repeatedly today from me on many of the questions. So again, thanks so much for being here. I'm happy to answer any questions. And our pathway forward, our success forward is going to largely depend on the business community and doing what it has been doing so far to prevent the transmission of this virus. So thank you.
Dr. Roussin, Minister Friesen, thank you very much for joining us both today. It's, I think most people over the course of the last number of months when it became 1 o'clock, they were always tuning in to see you anyways, Dr. Roussin. So I appreciate them doing this again today. And we've got this special time that they're used to seeing you at this time of day. I want to start and I appreciate everything that you've been doing over the course of this pandemic. I maybe want to start a little bit just in regards to the numbers that you shared today, in regards to the number of tests that took place yesterday. And I'm curious about that because I think over the course of the last week and a half, we've seen all these zeros on a daily basis. Can we expect to see more testing like this on a daily basis? And what kind of numbers would you like to see in terms of, from a testing perspective, from Manitobans on a daily basis?
Yeah, so it's a good question. So what we'd like is that what's really important is the testing capacity, which we have. We have a lot of leftover capacity. We can do many more tests than what we're doing right now. And then who's eligible. And so any symptomatic Manitoban is eligible right now. So from my standpoint, those are the most important metrics. The next important metric is the positive test rate, which is remarkably low for Manitoba. And so that's the number we're really following as we start to open up. If we see a trend increase in that rate, that's going to tell us we're seeing more community-based transmission and need to really open our eyes to that. As far as test numbers go, we certainly want to make sure we're getting a decent sampling from Manitobans every day with it. A lot of that has been driven by demand, but we are doing some targeted asymptomatic testing. So, so certainly if we were, averaging that, 5,000 to 7,000 tests in a week right now with those test positivity rates, we would be doing quite well with our numbers. If we saw more and more cases, we'd want to see those go up.
Thank you, Dr. Roussin. And my question is something that we've been hearing from the business community extensively since the reopening phases began. And again, recognizing just the outstanding work that yourself and the entire provincial government have done in guiding us through this pandemic. But especially now with the announcement around phase 2, what we are hearing from the business community is what is perceived as really mixed messages. Be it on this call or the one we did with the Road to Recovery, the message from health officials is if you can remain working from home, please do so. And then we also have a message of reopen your business, get your employees back. So there appears not necessarily a disconnect, but some businesses and their employees are struggling to understand, do I stay home? Do I go into the office? Do I open my business? If we could just get some clarification around what you mean when you say if you can stay home and how that fits into the reopening plan.
Yeah, right. And so it's good, a good point. I think that we definitely are in this new normal with it. And so the advice necessarily isn't just, a blanket, if you can, then do it. What we've heard from a number of companies and organizations is that when they've allowed a number of their employees to work from home, it's just as good as it was before. There was no downside to it. And they, in a lot of ways, they found benefit from it. So my advice to those is if you're working from home now and it's working out well for your business, there's no reason to change that. We're in a new normal. The more, the less we can be crowded, the better. If you've been virtually meeting and that's been working out fine for you, I don't see a reason to change that with it. So it's certainly not saying, by all means, don't go back into work. I think our numbers have set us up. We can get employees back in. We have some restrictions, but it's just that it's not a return to normal. And so if working virtually or even certain aspects of working virtually worked out for you, then I would encourage you to find ways to continue to do that. And even with travel, we see that our risk is importation of the virus. And a lot of people would travel as normal parts of a business, but I would say, is it essential? Can it be accomplished in any other ways? Then maybe consider those ways.
Okay, thank you.
Dr. Roussin, we're getting a lot of questions in regards to event planning, and we'll touch on some of those a little bit later, but we're also got from specific sectors, and one is from the retail sector, and the question is along the lines of this individual has witnessed tellers or cashiers in stores using the same pair of gloves with customer after customer. Is that something that is a possible for cross-contamination? And the second question is, what are sort of the cleaning requirements for retail clothing stores, specifically consignment clothing? I wonder if you can maybe address some of those questions.
Yeah. So one, the gloves in the non-healthcare setting, I'm not a huge fan of. It's much more important for those cashiers to wash their hands after every interaction. So I would think it would be much better to skip the gloves and use hand sanitizer or wash your hands after each interaction. And that would be the most important thing. We know that this virus can live on surfaces, but you can't get it through touching and touch your eyes or your mouth with it. And so this is why we're avoiding that. We're frequently washing our hands. So I would say hand washing in almost every situation is way more important than wearing gloves. Now the second part, the consignment, yeah. So returning clothes, I think this is a relatively low risk venture. Living on smooth, hard surfaces, that's where we notice this virus being detected. It's unlikely that we're going to see a lot of transmission from this virus through textiles, through clothes and things like this. So, it'd probably be the same thing, screening of people, ensuring that they haven't been ill or haven't traveled. If there is a way of just doing routine laundry on them, then that would be, getting into a zero risk situation or very close to one. And then if not, then just even shelving them for a number of days is further decreasing the risk. But, transmission through clothes, pretty low risk.
Thank you, Dr. Roussin. My question's for Minister Friesen. Policy question. Is Manitoba considering providing incentives for workplaces that offer increased work from home flexibility, if that is the desire of the province? Just curious as to what kind of policy changes you may be considering.
So I won't speak for my colleague Ralph Eichler, the Minister for Economic Development, or for Minister Fielding in Finance, but I will say this, that we're seeing, of course, that we've had to do things very differently during COVID-19. And now some of the conversations, both in, here at the legislature, but also in the business community, is about how much of this change might end up being more pervasive and sticky going forward. To what extent have we really disrupted how we conventionally used to do things? So I won't do any policy making on the fly today. There's two sides to that question, obviously. There's that side from the public health point of view, where Dr. Roussin would say, if you can do things from home that you otherwise used to do, that might be a benefit. The other side of that issue, of course, is going to be someone who actually rents commercial space, who is saying, oh my goodness, what could this mean for the future of commercial leasing. And there is, tremendous benefit that has been well established of the ability to work together. And, I think of the work we do at conference tables. And this changes a lot of that. Some of this work can be done remotely. So no policy on the fly for now. It is a good question, though, to raise about where will the government be in terms of, providing incentive in future for this or that other thing that we may want to incent. I can tell you generally that those discussions do continue at our tables of how to help, how to appropriately help, and where that help might be best directed.
Excellent. The next question, I think one of the interesting things, I think, for a lot of parents out there with kids is now potentially in phase 2 is the opening up of outdoor sports. And I'm curious from Dr. Roussin's perspective, what that looks like. Is it up to the individual sports programs, whether it be baseball or soccer programs, to provide you with an overview in terms of what some of the measures that they're looking to take to make sure that this is done safely? Or I'm curious just in terms of what that process looks like for some of these sporting programs to be able to move forward, to give parents and kids that confidence that things are being done in a safe manner, as you talk about.
Yeah, and so this is another one of these balancing things that we're seeing such low transmission of this virus right now in our communities. There's such a huge benefit of getting people out and active and sports going on. We've heard of, certainly unintended consequences of mental health issues and things. So we wanted to get those opportunities to get people out and active in a safe manner. And so with these sports, we have overall guidelines for these sports on things to look at, areas where people are congregating, say a bench and things. You got to make sure you can get that physical distancing in. Certainly, again, can't have any kids showing up to a soccer game that are ill. And so we're going to be relying on people to screen and to ensure that there isn't anyone showing symptoms while they're playing. And then, like you say, each sport, it would be tough for public health to develop quite specific guides for each type of sporting activity. And so we've directed them to a lot of online resources, but it's going to be up to those organizers to apply the general advice to the specific situation.
Would there be certain sports that are more, body contact, like football and those kind of things, that you would suggest are probably not good to be moving forward at this time, though?
Well, it's all a risk level, right? So if you're in a sport that there's minimal close, prolonged contact, then that's certainly the safest sport. These other sports, even we talk about martial arts, boxing, football, and things like this, they carry with it more of a risk. But we want to advise Manitobans of that risk, things they can do to modify that risk. But we're going to leave it up to Manitobans to decide what level of risk that they feel safe with in those situations. But a lot of the things, the screening is vital. The hand sanitation, and doing whatever these sports can do to minimize that close, prolonged contact is going to further reduce the risk.
Are the sports, though, are they mandated to be able to provide you with the measures that they're taking? Is there like a sign-off process or something? I wonder if people are looking at?
No, there's not going to be a specific way of submitting something to us and then approving it. We're going to leave that the onus on them. Similar to many businesses, we'll provide guidance as we can, but there's lots that are going to have very specific endeavors that we can't possibly provide advice on everything. So people are going to have to do their due diligence on these things.
Thank you, Dr. Roussin. I'm going to combine kind of two questions into one, because one of the questions, again, we're hearing a lot from business is what the recommendations from the province are as it relates to testing employees prior to arriving on the work site. For ourselves as a chamber, we've been recommending the self-assessment tool, but are there other measures that you would recommend for employers as it relates to their employees returning? In particular, though, have you given specific advice to commercial landlords in multiple story buildings, notably the downtown office towers? Is there guidance that you've given them around physical distancing and congregation points, lobbies, and elevators?
Right, yeah. So certainly the online screening tool is vital for organizations. I would recommend everyone have that in place. One of our most recent cases could have been avoided. A lot of contacts could have been avoided if that screening tool was in place. And so certainly it's vital. So I would recommend that to everyone. Testing is a interesting thing with asymptomatic people. And so one is the testing of people that takes 48 hours to get things back. And so a testing of a negative person tells us that they're negative right at that particular period of time. They could develop symptoms the very next day. That could be COVID. And so there's not much use for widespread asymptomatic testing. Certainly targeted asymptomatic testing, like people, what's our highest risk? People bringing back the virus into our province. So we're looking at maybe testing those people frequently. But as far as having that to allow people to enter the workplace, not going to be feasible and probably not all that useful for it. As far as the large buildings there, it's again back to those basics. It's the physical distancing, doing whatever we can to maintain that 2-meter separation. Congregation, they're going to need to abide by the 25 rule, but that 25 rule isn't set. If your room can't contain 25 people with the 2-meter separation, it has to be lower, and so that applies to elevators, all of these things. So it's the physical distancing is essential.
We have a question as well, just in regards to libraries, and they indicate they're getting conflicting information on the safety of circulating library material. And is circulating library material safe, and can they let people browse in the stacks? And do they need to quarantine books before recirculating them?
Yeah, it's a good question. Again, I think this is a pretty low risk endeavor here. I think that the screening tool is important. I think the ability to have frequent hand sanitizing at the library is important. To wipe down frequently touched surfaces is important, but the transmission of COVID through a book, very low likelihood of that. And similar thing, we have to get back to living with this virus. We have to get our lives moving with caution. So we touch lots of things during the day. We pick up our groceries, we carry bags, we carry stuff for work. This is just the importance of washing those hands as frequently as possible. And that's going to limit the chance of spread.
Thank you, Dr. Roussin. My question is for Minister Friesen. We have a number of organizations, companies, of course, that work right across Canada and are dealing with a number of health protocols similar to trade barriers in our country. There's different rules governing every single province. And so I guess my question to you is if you could talk a little bit about the conversations you're having with your provincial counterparts, trying to really have a uniform approach to public health measures, reopening protocols, so that those organizations that operate from coast to coast to coast are not having to employ 10 different people to analyze what's going on in the various jurisdictions. Thank you.
Thanks, Lauren. It's an important question because, as you say, as we conduct commerce, there are many businesses and in many sectors where that's done in all provinces, in some provinces. And this has been disruptive to everything from supply chain on. But as we restore, like you said, consistency matters, because you're trying to navigate these things in multiple jurisdictions. This is why Brent sits at the table that he does with the Special Advisory Committee for COVID-19. It's why myself and my counterparts continue to meet as health ministers with the federal minister, with Dr. Tam, the national chief health officer, on a regular basis. We're meeting weekly, if not more than once a week, to talk about what's going on. And we share in detail what we're doing in other provinces. We take away learnings from other provinces. And we are now, as you know, I wouldn't say that there's no way in which we say the risk is over, but right now we do see this plateau going on that's allowing us to act. And during this time, we're also now turning our attention to exactly what you're saying. Consistency of our conditions. We won't all do the same things. And some of these things will be particularities to Manitoba. But broadly speaking, the more consistent we can make these things, the better it will be for continuity and business continuity. I'll give only one example. When it comes to contact tracing, the Premier has spoken about this. Brent and I have discussed this. Brent at his tables is continuing to represent Manitoba's interests. My feeling would be that we would be much better served as a population in this country to have a solution for contact tracing, a digital solution that will both meet the needs of public health, but be able to work between jurisdictions. And if every province ends up making up its own solution for contact tracing, it's going to be impossible for businesses to navigate who need to travel to do business. So it's only one area in which we're continuing to push and say to the feds, you could lead this, you should lead this, one solution for the country.
Thank you, Mr. Friesen. Dr. Roussin, I've got, there's a number of questions from event planners, specifically wedding planners. So I'm going to shotgun a whole bunch of questions at you all at once. And maybe we'll just kind of quickly kind of go through them. Outdoor tents, capacity of 50, correct?
Well, you know what? That's going to depend on, so the gathering size outdoors is 50, indoors is 25. And so if it's a tent that is just a covering,
Yep.
then yes, probably 50 would be there. But again,
Okay.
with social distancing.
Okay. Are caterers allowed to serve food?
So here's the thing is we don't allow buffet style
Okay.
going on now. So that's the limitation. Other than that, it's the typical guides.
With table capacities, again, for round tables, I'm guessing as long as you've got the social distancing?
That's right. So we have the group size limitation, and then with the table between tables need to be the 2 meter separation, and then the 50% capacity. But at a single table, we don't really have a specific restriction.
Dance floors?
Dance floors are closed in licensed liquor establishments. We do allow for dance lessons with restrictions.
Dances at a wedding, would that be outlawed then?
Yeah, you know what? At a group setting right now, those congregate areas need to be closed.
At a wedding, would everyone need to be provided with hand sanitizer?
Well, everyone should be. There should be access to that. It's not going to be certainly in an order that it would be required, but the ability to frequently sanitize is good.
And can drinks be served at a bar at a wedding?
Yes. It's the restriction of bars are a 50% capacity. They must be able to be seated because we're closing off all the congregated areas, and so it's likely that it's best being served like at a restaurant.
Okay, perfect.
Thank you, Dr. Roussin. And I note that the dance floor question wasn't part of it. It was Chuck asking.
But he can take dance lessons and probably needs them.
Well, I've seen him dance.
Can I get in on that last question as well? I understand there's been lots of questions raised by people like wedding planners, and I'm even watching the chat lines at the bottom. Great questions coming from the wedding planning industry, and we realize it's very complex for groups like this to be able to navigate these rules. I believe that we now have online a compendium of questions and answers for wedding planners. It's something that Brent and I had agreed to in a call we had done earlier this week. If it's not up, it's going up. Manitoba.ca/restoring safe services. And we have a very significant information bank there for these groups. So it's not all contained in the document you see here. There's good information in here, but there's more guidance online that allows you to search by key terms. It's very good. It's being well utilized, but we're going to have that up there for wedding planners as well, because there's so many of these questions that are so important.
Thank you, Minister Friesen. My last question is to Dr. Roussin, and I hope this does not come off as pessimistic or fatalistic in any way, shape, or form, but it is one of the effects of being married to a healthcare professional myself. A lot of discussion about vaccine, and that we potentially are 18 months, 24 months or longer out from a vaccine. And again, this is the danger of having a little bit of knowledge and not being an expert, because I'm sure you're dealing with a lot of armchair experts in health, but it is my understanding that in the history of corona novel viruses, we have never developed a vaccine. So the reason I raise that is, wonder if you could speak to that. And the messaging, and this is what we've been trying to drive home, is we need to stop pinning our hopes on a vaccine and we can't do anything until a vaccine. That effectively the virus is here. It's a risk. We need to manage the risk. And whether there's a vaccine in our future or not, we still need to be taking these precautions. Just wonder if you could speak to the vaccine issue and go forward.
Yeah, so it's some good points there. So I would say that, the vaccine is, at the earliest, maybe a year away. But remember, when we say a year or 18 months or 2 years away from the vaccine, that doesn't mean vaccines in people's arms in that time. So we develop a vaccine, and then it's going to take a long time to get vaccine into people's arms. We've never developed a vaccine against a novel coronavirus, true, but with the acknowledgement that the only previous really novel virus that we could have picked up was SARS-1, and it disappeared. If it didn't disappear, we probably would have had a vaccine to it. So we're anticipating a second wave, although this predecessor virus didn't have a second wave. But we need to be aware and ready for it.
Thank you.
Dr. Roussin, maybe one final question. And as more businesses are starting to open, there's a question just in regard to large office towers that they've got unique challenges giving multi-tenants and reliance on elevators, et cetera. Is the province providing specific guidance to owners and managers of large office towers to mitigate health risks?
Yeah, so I don't know if we necessarily have specific guidance in that regard. It's something that we could look at. But again, it's a lot of it is right back to that. You're going to need that 2-meter separation. And so that might mean, depending on the size of the elevator, a specific number of people on at a time. I'm sure that's going to pose some operational issues, but we just can't have a crowded elevator at this point, anyways. So, but we could look to that. Certainly things like engagemb.ca questions can be forwarded to, and we often will get that out, and that adds to our compendium that's online.
Minister Friesen, Dr. Roussin, I want to thank you both for taking part today. It's almost time to wrap up, but we'd like to ask one final poll question. Now that our experts have answered as many of our questions as we've been able to put forward, the final question would be, how would you rate your confidence level with respect to understanding and following those safe operating procedures and health protocols? And so we've got some answers up on the screen there, and I would suggest that take a couple seconds here. All right, we'll expect the results to pop up. So we've got more than 33% very confident, just almost 50% somewhat confident, which I think is pretty good in terms of the information that you've shared and how confident they are with the protocols and understanding them to make sure that we're opening safely. So a huge kudos to the business community, and thank you again for taking part. I want to thank everyone for their honesty, and I will pass the torch back to Peggy May, our chair, for some quick closing remarks. Peggy?
You?
There you go. I need to start my own video. Thank you, Chuck and Lauren, for hosting all of those questions. Amazing. And there's still, I see lots that we probably didn't get to today. But thank you very much to Minister Friesen and Dr. Roussin for joining us today. We deeply appreciate the time you've taken this week to consult with members of our Manitoba business community. To our attendees, if there are any questions we didn't get to, and I see that there's many, we'll collect those and find the answers for you. We've recorded this session, and we will send out the link to all the registrants along with a link to the Q&A. We also want to remind you that Phase 1 and Phase 2 recovery toolkits are both up on our website at jointhechamber.ca, and it's all broken out by sector. You can also go to the Government of Manitoba's website to read workplace guidance for business owners. This guide contains practical information about minimizing risk, PPE, precautions for staff, etc. Or if you have a specific question that is unanswered, you should go to engagemb.ca anytime to submit it and receive a response by email. Together, our chamber network has worked tirelessly to support our members from all corners of the province. We are so proud of the collaboration we've seen regionally across Manitoba with our provincial, territorial colleagues and at the National Chamber Network level. We've been pushing hard for effective recovery strategies and emergency relief, and we will continue to do that. We need to understand clearly what businesses need in terms of support to move forward. So please ensure you take a few minutes to complete our joint chamber survey related to economic restart conducted by Ledger Marketing. You can go to the Manitoba Chambers or the Winnipeg Chambers websites to access the survey. We're all in this together. Thank you all for joining us today, and take care. Thank you.
Thanks, Peggy.